Hi.
So my name is Angelica, and I'll be your intern for today.
Awesome.
So what brings you in?
Well, I'm a new patient, but today I've been feeling a lot of like stiff neck symptoms over here on the left side. Yeah, it started earlier today. I got a massage and then I went into the rain outside, and I think everything just started seizing up because of that.
Okay.
Yeah, I just want to make sure there's nothing weird, and yeah, I just wanted to get like a full checkup as well.
Okay. And has that happened before?
Yeah, it has happened before, not specifically like going out in the rain triggering it, but I've had stiff neck symptoms every once in a while, maybe like a few times a year.
And compared to the other times that you've felt the stiff neck, is it any different today?
It's pretty much the same.
Okay.
Yeah.
Alright, and if you had to rate the intensity of the sensation that you feel, so from 1 to 10, 1 being bearable and then 10 being the most excruciating pain that you've ever felt, where would you say it feels?
Right now, right now it doesn't feel painful, but if I like move my shoulder or my neck a lot, then it probably feels like a 5 out of 10.
Okay. Aside from moving your shoulder and neck, anything making it worse?
Not that I know
Okay. And have you tried anything that makes it better or noticed anything?
of. Well, it does feel better when I kind of like massage like my shoulder here and then my upper neck area. Just kind of like applying some friction helps, but yeah, it doesn't take it away or anything.
Okay. Have you noticed anything else happening to you aside from the neck pain that you've noticed?
Well, I did feel kind of fatigued today. I don't know if it's just because I was outside in the rain gardening, and I don't know if it's because of that, but I came back and I was just feeling really tired and I had to take a nap.
Okay.
Yeah, and then also my throat does feel a little bit sore. And I think that's just like being out in the cold as well, yeah.
Okay. So the sore throat you've noticed roughly the same time as the neck pain? Okay.
I have a pretty poor immune system. I end up getting sick pretty easily, whether it's like not being dressed warm enough or not sleeping enough, like just things that might cause my immune system to kind of act up a little bit and not work that well.
Okay. Well, we'll definitely go through a few exams on you just to make sure that your throat is assessed, your neck is assessed, and as well as other parts of the body, just to make sure that nothing is going wrong, and see if any special tests are needed. Is that okay with you?
Yeah, of course.
Okay, so I'm going to start off with some vitals along the way, and then we're going to go through other specialized exams.
Awesome.
Okay. I'll use your right arm.
Okay.
Is that okay? Not too tight, not too loose?
Yeah, seems good.
Okay, you can just let me hold your whole weight of your arm. Okay, I'm just gonna have you put your arm up really, really far
High.
up. Yes, far up to the wall or the ceiling, and then just pump 10 times for me.
Okay.
Perfect. Alright, perfect. So I have 98 over 62. Okay, so it's a little bit on the low end. Is that normal for you?
That is.
Okay. Do you experience any dizziness at all?
Yeah, sometimes I get up from squatting and my vision goes black.
Oh, okay.
And yeah, so I think definitely low blood pressure.
Any headaches?
Not really. Usually when I have stiff neck, I also have like a tension headache, but not right now. I seem to be okay.
Okay.
Yeah.
Alright, yeah, sometimes low blood pressure can do that. It can cause some lightheadedness, and it can also trigger some headaches. That might be the reason why. Okay, so now I'm just gonna take your temperature.
Okay.
There we go. So I'm just gonna get you to put this under your tongue and form a tight seal with your lips and just wait for it to beep. And for the meantime, I'm just gonna be holding onto your wrist to feel your pulse. There you go. Okay, 36.4. So that is within normal limits. You don't have a fever.
Good. Sometimes I do feel a little bit warmer than usual. But like I don't end up having a fever or anything, just a high temperature. Well, not a high temperature, but I feel like a little flushed. I don't know.
When you're rested or after you've been moving around a little bit?
I think it's when I haven't slept enough. Yeah.
So you tend to be a warmer constitution in general?
I tend to be cold, but when I'm not well rested enough, I just feel a little like flushed, like just kind of warm. Yeah.
I wonder why that might be. It could be your immune system kicking in, or it could be just your body's way of defending itself by increasing your circulation, just to be able to bring more blood flow to the brain, possibly, after a bad night's sleep. But there are many reasons why, but that's a potential one.
Cool.
Yeah. So I actually got 62 beats per minute, and I measured 15 breaths per minute. So those are both normal. So it doesn't seem like you have you're hyperventilating. You don't have any tachycardia or bradycardia. So everything looking good so far.
Great.
Okay, so I'm gonna now proceed with other exams. So I'm just gonna check your skin first. So can you just bring your hands out for me?
Yeah.
Thank you. Okay, so I just see a little bit of dry scaliness on your right palm, on your 5th and 4th digits. So near, I would say near the interphalangeal joints and the metacarpal joints. And that's been there for a while?
Yeah, for the past few months. It used to be sort of like just on my ring finger here, but now it's traveled down to the palm and also the back of my hand.
Okay, and your skin looks moist. Let me see your other hand as well. It looks well perfused, not overly pale or red. And then just flip your hands. Okay, so same thing you have on the other side of the 4th and the 5th. Some dryness there. I would probably say maybe 2 or 3 inches. And so yeah, 2 inches width, and then length would be 3. I'm just gonna check your cap refill. Okay, cap refill is good, less than 2-3 seconds. I don't see any ridges on your nails. I'm just gonna get you to put your fingers up close like this. Okay, yep, so no clubbing of fingers, which is a good sign. Now I'm just gonna check the other parts of your skin. Okay, you don't appear to be cold.
Yeah, I'm definitely feeling warm right now.
Okay, I'm just gonna check your feet. Okay, so I'm just gonna take a look at your feet to see if there's any rashes. So I don't see any redness. Or any other types of discolorations. Your nails look healthy.
Do you want me to? That's my legs.
Yes, thank you.
Sorry.
Perfect. Okay, I'm just gonna get you to show me the bottom of your feet.
Okay.
Okay, perfect. Alright, so I see a few, it looks like a little few abrasions on
Yeah,
your
that's when I
right.
was shaving.
Yeah, okay. Alright, so just a few little dots there, but nothing more, no bruising. Oh, there's one bruise here on the left side, on the medial side of your calf.
I think that's when I was gardening and I hit myself against a planter box.
Oh, okay. Well, it looks like it's healing in the right direction. Okay. And everything looks good. Temperature is good, not cold, not too hot. And while I'm here, I'm just gonna feel for your dorsalis pedis.
Okay.
Yeah, it's there. It's just a little faint, but it's there. So that just indicates that you have good peripheral vascular circulation. Alright, so Semide, can I just get you to pull down the collar of your shirt? Perfect. So I'm just gonna see if there's any rashes here. So I don't see a maculopapular rash that could indicate scarlet fever. Just see here. Okay, just a few nevi, but nothing that looks concerning. Okay. Okay, no rashes there. I'm just gonna look through your hair and just see if there's any signs of patches of hair loss. Your scalp looks moist, not flaky or dry. It looks healthy. No redness. I don't see any patches of hair loss. Hair is full, there's no thinning. Looks very healthy. Okay, I'm just going to feel your scalp. Let me know if there's any pain.
Okay.
Okay, no signs of head trauma. No tenderness. Okay. Okay, so now I'm just gonna see if your lymph nodes are enlarged, and just let me know if you feel any tenderness at all, okay? Okay, I'm gonna get you to just shrug your shoulders for me. Okay, you can rest. Okay, I don't feel any enlargements. Are you okay? Okay, so to test your masseter and your temporalis, I'm just gonna get you to clench your jaw. Okay? So clench your jaw for me. Okay. Do that again. Okay. All right, feels equal on both sides. Okay, Semide, I'm just gonna get you to look into my eyes, so look straight forward. I don't see any lateral thinning of the eyebrows that could indicate hypothyroidism. I'm just gonna get you to close your eyes for me. I don't see any redness or swelling on the eyelid. Okay, you can open your eyes, and I'm just gonna make contact now. Is that okay? Okay, so I'm just gonna lower your eyelid. I'm gonna get you to look up for me. Perfect. Your sclera looks white, no hemorrhaging. Perfect. And I'm gonna get you to look to the left, to the right, and then downwards. Look up at me. Okay, no signs of lid lagging, and I don't see any injections on the sclera, and I don't see any nodules or sty on the lower eyelid, so your eyes appear to be perfect. All right, so now I'm just going to check your pupillary light reflex. Okay, so I'm just gonna put my hand here. Okay, direct reflex is intact and consensual. Okay, direct reflex is there and consensual on both eyes bilaterally. Okay, now I'm just gonna do the H test. So I want you to focus your eyes on the top part of this pen light without moving your neck at all. I'm just gonna get you to trace with your eyes. Okay. Okay, I don't see any nystagmus. Perfect. All right, so all of your extraocular muscles seem to be intact. We can proceed with more tests.
Okay.
Alright, so Semide, we're gonna go through the ophthalmoscope. So I'm just gonna get you to focus your eyes on something behind me, and just keep your eyes forward. So there's gonna be a bright light in your eye, so it might feel a little bit uncomfortable, but I can promise you I'll try to be as quick as possible to visualize the retina.
You can take your time.
Okay. Okay. Alright. Okay, I see the red light reflex on both eyes. Okay. I see the arteries and the veins, and they're merging onto the optic disc and the cup. And the ratio between them is roughly around 1/3. And I don't see any AV nicking or drusen or cotton wool spots or any flame hemorrhages. And I don't see any papillary edema. Okay, I'm gonna check the other eye now. Just look at the wall. Okay. Alright, so same thing. I don't see any papilledema, no AV nicking, no cotton wool spots, or flame hemorrhages. And the fundus appears to be pinkish, orangey in color, healthy.
Awesome.
Thank you. Okay, so next would be nose. So I'm just gonna get you to plug one of your nostrils and take a deep breath in and out. Okay, let's now switch to the other one. Okay, so nasal patency looks to be intact. Now I'm just going to look. I'm just gonna look at your external nose to see if there's any deviations or polyps that could be obstructing the airflow. So I'm just gonna get you to take your finger just on the tip of your nose and pull up, and then just bend your neck backwards. Okay, so your mucosa looks a bit erythemic. More so just on the left side. Do you feel a little bit congested at all?
A little bit, yeah.
Yeah. Yeah, it just looks a little bit swollen on the left nostril, but the right one appears to be fine.
Okay.
But there's no mucus that I could see, so it might just be some swelling. Do you have any allergies?
I noticed some allergies a few weeks ago. I noticed some allergies a few weeks ago, but I think I'm okay now.
Okay.
Yeah, although the sore throat's kind of on this side too, so I don't know if my tonsils are enlarged. Maybe you can let me know.
Yeah, I'll definitely check the inside of your mouth and throat to see if there's any swelling there.
Okay.
Okay, so I'm just gonna get you to open your mouth for me. Say ah.
Ah.
It's hard to see the back of your throat. I'm just gonna get you to stick out your tongue. Can you do that? Let me get my pen light. Okay, just do that one more time. Okay, so your tonsil is slightly enlarged.
It is?
Yeah, just a little bit. I would probably say just like grade 2.
Just
maybe
on
grade
this
3.
side?
Just on this side. Let me just look one more time.
Okay.
If that's okay. I can't get a clear picture, but I was able only to see the side being more enlarged.
That's the side I feel a little sore.
Yeah, I don't see any exudates on there. It just looks a little bit erythemic on the tonsil. There's no swelling or redness on the posterior pillars or on the soft and hard palate. Okay, just open your mouth for me. Okay, your oral mucosa appears to be pink and moist. Stick out your tongue. Perfect. You have a little bit of scalloped edges on the side and a little bit of a yellow coat. So in traditional Chinese medicine, a flabby or a swollen tongue could mean a little bit of dampness. And that usually happens when you have a lot of like yin that remains, you're not moving it enough. So there's not a lot of yang to move it, should I say. Okay, Semide, I'm going to give you a throat exam, particularly the thyroid, just because I want to rule out any thyroid associated conditions. Is that part of your family history or personal history at all?
No.
No? Okay.
I mean, there is some autoimmunity. Like, my mom has rheumatoid arthritis.
Okay.
Yeah.
Okay. Alright, so we'll just do a thorough assessment then.
Okay.
Okay, Semide, I have a glass of water here for you. I want you to take a sip, and I'm just going to observe your swallowing.
Okay.
Okay, it looks symmetrical on both sides. Your vagus nerve is intact.
Alright, thank you.
Thank you. I don't see any shadows being casted, so I don't think you have any goiters. Okay. Alright, so I'm just gonna look up my landmarks. Alright, so there's your hyoid bone, your thyroid cartilage, and your cricoid cartilage, and then your suprasternal notch. Okay, I'm just gonna get you to bend your neck a little bit downwards. You might feel a little bit uncomfortable because I'm pressing your trachea to the side. Alright, so your thyroid doesn't appear to be enlarged. I didn't feel any hard nodules or any sort of hardness on both lobes. And I felt your tracheal rings, so looks healthy.
Thank you.
Okay, so now we're going to go through some ear exams, and then that's going to be followed with some neck range of motions. I just wanted to leave that a little bit to the last because that might cause some exacerbations.
Okay.
Okay, so I'm going to start off with the whisper test. Okay, I want you to cover one side of your ears, and I want you to repeat the word after me. Okay?
Sandwich.
Okay, and then the other side.
Breath.
Okay. Alright, perfect. Alright, so we're going to be moving on to the Weber test. So I'm going to be placing this tuning fork on the top of the vertex of your head, and I want you to tell me if you can hear the sound louder in one ear compared to the other, or if you don't hear the sound at all, or if you hear it equally on both sides.
Okay.
Okay?
Equally on both sides.
Okay. Alright, so now I'm just gonna do the Renee. So I'm gonna be placing the tuning fork on your mastoid process, and then let me know once you stop hearing the sound, and then I'm gonna be moving it closer to your ear, and then again, let me know when you stop hearing it.
Okay.
You can still hear it?
Still hear a little bit. Okay, it stopped. Hear it. Stopped.
Perfect. Alright, so now with the other ear.
Okay, stop doing it. Here. Stopped.
Perfect. Okay, so I'm just going to look at your external ear, okay?
Okay.
Let me know if you feel any pain or tenderness. Okay, so that's negative for otitis externa. Any pain?
No.
Okay. Alright, so also negative on that side and no sign of mastoiditis.
Okay.
Okay, Semide, so we're gonna do an otoscopy exam. Is that okay with you?
Right.
So I see your tympanic membrane. I don't see any effusion or bulging. It doesn't appear red. I see the umbo and the other bony landmarks. And I also see the pars flaccida and the pars tensa. No effusion.
Yeah, I haven't had any ear pain with a sore throat, so.
Okay, that's good. Alright, so we'll just check the opposite ear. Alright, so I don't see any cerumen that's covering the external meatus, and I can see the tympanic membrane clearly. There's no erythema, no swelling. I see the bony landmarks, the umbo, again with the pars flaccida and the pars tensa. So there's no sign of otitis media. Okay. Alright, so I'm just gonna get you to follow my directions in terms of moving your neck.
Okay.
Okay, so I want you to bring your chin to your chest for me. As much as you
That
can.
kind of hurts a little bit.
Okay, you can stop right there. Perfect. And I want you to just look up at the ceiling as far back as you can.
That hurts.
Okay, you can stop right there. And then I want you to just move your neck so that you're looking over your right shoulder.
It hurts.
Hurts? Okay, you can stop there. And then just do it on your other shoulder.
It hurts about there.
Okay. Okay. And I want you to bring your ear to your shoulder.
It hurts.
Okay. Alright, and then your other side too.
It hurts.
Is there a side that feels worse?
It's always the side that feels worse.
Okay, so your left side.
Mm-hmm. I feel
Okay.
the pain always on the left side.
Okay. Okay, so this will be better if I have you laying on the table. So
Okay.
I'll set up the bed for you.
Okay.
Okay, Semide, so I'm just gonna be moving your neck for you. Let me know once it gets too painful and I can just stop.
Okay. Just feels a little uncomfortable, but it's not really painful.
Okay.
It's kind of painful there.
Okay. Yeah, that's your left side.
Yeah, it feels painful on the left again. That one is not too bad. Oh, that one doesn't feel good.
Okay, and then in terms of extension, it'd be better if I have you laying on your belly.
Okay. Like this?
Yeah, you can do that. Okay. Painful?
That seems okay.
Okay. Okay. I want you to tell me once you feel pain, okay?
Okay.
You can flex your knee. Yeah, let me do all the motions for you.
Okay. No pain. No pain.
Okay, so we've both done the legs, and that's a negative for the Kernig's test, which would indicate meningitis.
Okay.
And since I flexed your neck, that would have been the Brudzinski, and that was negative, and that's also testing for meningitis. Okay, Semide, we're just going to do the posterior chest exam.
Okay.
I'm just gonna untie the knots on your gown. Okay, I'm just gonna start off with inspection of the skin. I don't see any nodules, any redness, any scarring, no vesicles. I see a few nevi, but nothing that looks concerning, of different colors. Let me know if you feel any pain or tenderness, okay?
Okay.
Any pain?
No.
Okay. So I'm gonna do a few methods here. So we're gonna start off with whispered pectroliloquy. So I want you to say the words 1, 2, 3, and I'm just gonna be placing my stethoscope on your back.
Okay.
And so every time you feel the stethoscope move around, just repeat the words 1, 2, 3, okay?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. No signs of consolidation. Now with tactile fremitus, I'm going to be putting the ulnar edge of my hands on your back, and I just want you to say E.
Okay.
Okay?
E, 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 E.
Okay, I didn't feel any increased abnormal vibrations, so no signs of consolidation as in pneumonia. Okay, now I'm going to be listening to your normal breath sounds, so just take a deep breath in and out for me.
Okay.
Alright, all breath sounds were vesicular. I didn't hear any bronchi or any sounds of crackles, which could indicate fluid in the lungs, which is not the case for you.
Okay.
Okay, now I'm just going to visualize your thoracic expansion just to see if both sides are equal. So I'm just going to put my hands around your back.
Okay.
Okay, take a deep breath in for me. Out. One more. Perfect. So everything is symmetrical.
Great, thank you.
Alright, so Semide, I'm just going to unbutton your gown just on the back side so I can just expose your shoulders and your anterior chest.
Okay.
Okay, so I'm just going to get you to just protect your breast tissue for me. Let me know if you feel any pain.
Okay.
Perfect. Okay. Okay, so again, if you feel the stethoscope on your body, just take a deep breath in and out for me.
Okay.
Okay, so starting just with in through your nose and out through your mouth. Okay, you can breathe normally. Okay. I don't hear any crackles or rhonchi. Your breath sounds do feel and sound a bit weak. Is that normal for you?
Yeah, I do have weak lungs.
Okay.
I've been told.
Okay. So that could also explain why you're prone to more infections and you have a poor immune system, especially when it comes to cold weather or when the seasons are changing. So now that we have spring coming in, there are a lot of pollen in the air, which could also be the cause of some of your symptoms. Okay, so we're just gonna go ahead with the heart exam now, okay? So I'm just gonna first do some landmarking. Is it okay if I just bunch this up?
Yeah.
Okay, now I'm just gonna get you to just protect your breasts and just lift them up so I can listen to the mitral area. Thank you. You have a strong heart.
Good.
So I didn't hear any regurgitation or any skipped beats that could indicate arrhythmia. I heard both the S1 and the S2 sounds. I didn't hear any additional adventitious sounds like clicking, like a holostolic click. I didn't hear that. Everything seems normal with your heart. Okay, Semide, we've done all the physical exams that I wanted to do with you. So far I'm thinking that what's going on with you on the neck is probably just some muscle strain from the massage. It might have been a little bit too much pressure or it might have been too vigorous. And so your neck, in terms of treatment, you need a warm bath or just putting some heat applications just on the neck.
Okay.
So if you have anything at home, like a heating pad, that could be really useful. So just applying that on the back side, on the side, and just making sure that you have it on for 15 minutes or less, whatever feels comfortable, but just don't sleep with it on overnight.
Okay, sounds good.
Yeah. And in terms of boosting your immune system, I think what's best for you is a tea. So for tea, I'm thinking echinacea and licorice tea. So sipping that 2 times a day or 3, just a cup. So you just just put the tea bag in 1 cup and let it steep for around a few minutes and then just sip through it.
Okay.
And I also want to give you a tincture. Okay, so in terms of the tincture, I want to give you Angiographis, Astragalus, and Eleutherococcus. So these are very effective adaptogenic immunomodulator herbs that will help stimulate your immune system to help protect you throughout the season, as well as helping you become resilient to any type of physical or emotional stress. Okay, and I want you to do 1 teaspoon BID, so twice a day, just for 2 weeks.
Okay.
Okay, and I'll give you enough to last then.
So where would I get that?
Yeah, so good question. So you can get the tea, you can get the tincture at the botanical dispensary. They will be able to help you and set that up for you.
Okay. What about in terms of diet and lifestyle? Is there anything I can do to help improve my immune system?
Yeah, that's a really good question. So number 1, I want you to prioritize your sleep. So make sure that you sleep early. I would say maybe definitely before midnight.
Okay.
Aim for 10 p.m. or 11 if you need to, and try to get at least 8 hours.
Okay.
Especially when you're sick, your body will tell you that you need more sleep. So just try to listen to what your body tells you. In terms of food, I want you to focus on very nourishing foods and warm foods. So broths, soups are really helpful and very nourishing, especially when you're sick, and just focusing on lots of vegetables, lots of mushrooms. Mushrooms are really great in soup. They're tasty, but they're also helpful for the immune system.
Okay.
Yeah, and also just drink plenty of water throughout the day, and if you can, make sure that they're warm liquids.
Okay. I'll do my best.
Yeah.
Thank you so much.
Yeah, you're welcome. Alright, so this is your prescription. I want you to take this to the dispensary.
Okay, sounds good.
Alright, well, if you have any questions, feel free to call me or email me at the clinic, and if things get worse or anything like that, just give me a call and we can set up a next appointment.
Okay, sounds good. Thank you so much.
Alright, see you later.
Bye.